Thank you. Senator Hassan.
Well, thank you, Chair Murray, and thank you again to our witnesses for being here. Mr. Corman, I want to start with a question to you. You have pointed out how dangerous cyber attacks can be to the health and safety of the public. In your written testimony, you stated that cyber attacks on hospitals and healthcare settings can lead to additional patient deaths, and that the impact is not limited to just the healthcare setting directly affected, but also in the surrounding region. As you know, over the past few years, ransomware has shut down several hospitals and healthcare settings in and around New Hampshire, including the University of Vermont Medical Center and the Coos County Family Health Services. You were working remotely in New Hampshire for CISA at the time. Can you speak to the impact that you saw of these attacks on the health generally of Granite Staters?
Sure. The excess deaths were really correlated to ICU strain, irrespective of cause. The top two contributors were not cybersecurity. They were people reluctant to try to seek medical care, introducing self-delay, and then the inability to get seen in a timely manner when they did. The question we asked is, can cybersecurity make it worse? And we were able to use data science to measure that, yes, it can. Just anecdotally, many of those affected systems in our neighboring state of Vermont, a lot of those patients were redirected and absorbed in the institutions in your own state. Yeah. I just heard a very sad story yesterday of a cybersecurity professional in New Hampshire whose mother needed an ICU bed. There were none within a 50-mile radius. She had to be treated less attentively in the ER and subsequently passed away. Yeah. Now, this is not this hack hit this person who did this. It's that we have finite capacity in our systems, right, especially during a pandemic and with the mass exodus of healthcare workers. Any elective strain, preventable, avoidable strain, like 4 weeks of downtime for oncology and other things. There's an incredible case study. They were very transparent about the impacts to their oncology program, yeah, and how those were pushed to surrounding states. There's only so much capacity, and when we are cavalier about avoidable, preventable harm, it has consequences.
Thank you. I want to give each of you